Welcome to Cancer HealthCast, where science is driving hope. I'm your host, Nikki Henderson. Today, I'm joined by Alaina Shreves, who is a predoctoral fellow with NCI's Division of Cancer Epidemiology and Genetics, Metabolic Epidemiology branch. Today, Alaina will be discussing key findings from a recent study on the use of accelerometer-measured physical activity and how it could help lower the risk of cancer, as well as how wearable technologies could also lead to major advances in cancer research. Hello, Alaina. Thanks so much for joining us on the show.
Hi, thank you so much for having me.
Can you start off by telling us about your role at NCI and how the Metabolic Epidemiology branch is helping the agency's overall mission?
Yes, I'm a PhD student in the NIH Oxford Cambridge Scholars Program, also called the OxCam program. This is a unique joint doctoral program between the universities of Oxford and Cambridge and the NIH. As part of my degree, I conduct research in the Metabolic Epidemiology branch, which focuses on understanding how metabolic and lifestyle factors like diet, exercise, and body composition may play a role in the development and prevention of cancer. My research looks at associations between physical activity and chronic disease using data from wearable sensors.
Can you talk a little bit about this new study using accelerometer measured physical activity? Why was it done, and how will wearable technologies like this help advance cancer research?
It might be helpful to start with just a little bit of background. So, cancer is a group of diseases that is characterized by uncontrolled growth and spread of abnormal cells. And it's estimated that over half of the cancers that are newly diagnosed in high income countries may be prevented by changes to modifiable risk factors, including addressing physical inactivity. Physical activity research has heavily relied on self report surveys in the past, but these don't always capture the full picture of daily movement, especially when it comes to lower intensity activities. There's a rise in the global market for wearable sensors, which collect more objective activity data. So, the goal of this study was to really use that wearables data to understand how even low intensity activities may be associated with cancer. We use data from the UK Biobank, which is a large population based cohort of adults across the United Kingdom. In the study, we had data on about 85,000 individuals who wore a wrist based accelerometer device for a week. We then went on to follow these participants for about 6 years using linkages to national cancer registries, and were able to track who went on to develop cancer later on. Using that data, we looked at relationships between physical activity and cancer, focusing on a composite outcome of 13 different cancer types.
What was one of the key findings of this study?
Yeah, I think one of the most important takeaways was that total physical activity, regardless of the intensity, was associated with a lower cancer risk. We found that individuals in the highest activity group had about a 26% lower risk of developing cancer compared to those in the lowest activity group. We found that higher daily step counts were associated with a lower cancer risk, and compared to people who took 5,000 steps per day, those who took 9,000 steps per day had a 16% lower risk. So overall, these findings really emphasize the importance of total movement for cancer prevention.
Oh, well, that is awesome to hear. That's really encouraging, really promising. Well, can you discuss some of the challenges that you encountered or had to overcome during the study?
Yeah, one of the major challenges was making sure we accounted for other factors like smoking, diet, and body mass index that
Mhm.
might also influence cancer risk. And this is a very normal challenge in epidemiology. But luckily, one of the advantages of working with a large cohort like the UK Biobank is that we really have super robust data. And we had detailed information on many health and lifestyle factors and could develop models that adjusted for a broad range of potential variables.
What is the mechanism of action? And can you explain how this may help lower cancer risk?
So there are several proposed biological pathways, and for example, regular activity has been shown to influence hormone levels like estrogen and insulin, has been found to reduce chronic inflammation, improve insulin sensitivity, and also support immune function. Activity also plays a role in helping people maintain a healthy body weight, which has been associated with a lower cancer risk.
Well, what is the main public health message that we should be getting out of this study?
Yeah, we found that increasing physical activity, regardless of intensity, may help reduce the risk of certain cancers. So, the most important thing is to really find ways to move more throughout your day. And whether that be walking your dog, playing with your kids, just being more active is very important.
Okay, so definitely let's just say for someone who is works from home and is in front of their laptop, it's probably very important that they get up and move and take breaks throughout the day, right?
Yeah, absolutely. So, thinking about taking a short walk, playing with your pets, gardening, just trying to stay a little bit more active in your day is really important.
Okay, great. Well, what are some of the other areas should future research focus on, and what role do you think technology will play over the next few years?
I think future studies related to this study should look more closely at physical activity risk for specific types of cancers. Each cancer type has very different etiologies, so it'd be great to study each of them more in depth. I think as far as the devices in general, wearable technologies are able to capture a very broad range of data of daily movement patterns. So it would be great to see these technologies being more integrated into everyday life and healthcare settings. There's definitely potential for them to help identify people who may benefit from targeted prevention efforts.
Perfect. Well, Elena, are there any other upcoming initiatives or projects that you're excited to talk about?
Yeah, I'm working on a new project that looks at wearable data in a different population. For this study, I'm looking at walking patterns in a representative sample of US adults. Here, I'm focusing on understanding whether a person's typical walking cadence or speed or pace of walking might have an impact on their mortality risk.
That's very exciting. Well, before we conclude, Elena, I want to give you an opportunity. Do you have any final comments or remarks that you would like to leave with our listeners?
Yeah, thank you so much for having me today. I really enjoyed talking about my research. I think the biggest takeaway from my study is that increasing daily physical activity, regardless of intensity, may help reduce the risk of certain cancers. And the key is to find activities you enjoy and make movement a part of your regular routine.
Okay, awesome. Well, I want to thank you so much for sharing the findings from the study on the accelerometer measured physical activity and discussing how important this is and how it impacts cancer risk and how it can lower your overall risk of developing certain cancer. So, I really appreciate you taking time to speak with me, and I hope that you have a great afternoon.
Thank you.
Thanks for listening to Cancer HealthCast, a production of GovCIO Media and Research. To explore our content, visit our website, govciomedia.com. Keep an eye out for new Cancer HealthCast episodes every month. And if you like what you heard, leave us a review on the podcast platform of your choice. Have a topic you want us to discuss? Contact us at newsletter@govcio.com.